Because there's always a lot of talk about pregnancy, about newborn care, but really what happens after all of that is done, right? So I'm just going to get started because we are a little bit like rushing for time. So my whole perspective is to kind of just talk about what to expect, right? That first few days of life after you have had the baby. So in a nutshell, what's basically going on is the baby's out, you've been through ridiculous amount of pain, or if you have the epidural, you're suddenly very numb, your legs aren't working, you don't feel anything down there. And that first crawl to the bathroom really is super painful because now you suddenly have to learn how to poo and pee through your vagina that now has stitches, that's been stretched, that is torn up, and now you have a newborn baby who suddenly is dependent upon you for everything and for all their needs, especially feeding. You have breasts that are now extremely sore and painful because it's learning how to produce milk for your baby. A lot of changes happening all at the same time, right? So there is the physical recovery, the emotional aspect, and how to kind of care for yourself. So nutrition and hydration, and how to take care of your baby and how to bond with your baby. So the very first thing is like that we know is obviously our uterus has expanded to a ridiculous amount of size in order to be able to accommodate the development of your baby. And now suddenly that uterus will now have to shrink back to its original size, which is literally this much. That's the shape of like the uterus in real life. So now you can see that this is the amount of shrinkage the uterus has to do to go back to its original size, and that's something we call uterine involution. So oftentimes, even after giving birth, you will still look pregnant for like a good amount of time because your uterus will take time to shrink back. All that space that was created to accommodate your baby, the organs that had moved, everything will slowly start to come back together, but that will take time. So there's no such thing as bouncing back. So be very kind and be very gentle with yourself when you do experience this really beautiful phase of life. The
Sorry,
next thing,
sorry, Munir, just to interrupt you for just 1 second.
yeah,
I just want to say if anyone does have any questions, feel free to just put them in the chat box, or you can send it as a private message to the SBMA admin host or Rashida Shamsuddin, and then we can always ask them at the end if you don't want your name there for the questions, okay? Sorry, I didn't mean to interrupt it, just so
no,
that
no,
as
no
we go
worries.
along, we don't.
Yeah. So important to ask questions to clarify any kind of misconceptions that you have or any questions that you have. So next up is the fun stuff, right? So you're gonna bleed. You're gonna bleed for a very, very long time. This is gonna be the longest period you're ever gonna have. So you're pretty much gonna bleed for anywhere around 4 to 6 weeks. For some people, it's actually even up to 3 months. So, and that is just all the products of conception coming out, right? So like we had the placenta, we had the uterus, we had the amniotics, we had like a lot of things inside of us that were there to help to help the development of your baby. So now everything is going to slowly start to come out. So that comes in the form of bleeding. This bleeding is quite heavy for the first couple of days. So you're going to see some really huge size pads and disposable underwear that people are using. And unfortunately, you do need to use those because the bleeding is unreal for the first couple of days of life. But it will pass and the bleeding will eventually stop and you will start to feel like yourself again. I promise you that day will come. So next is, of course, like you're going to have stitches. Those stitches are going to hurt. It's going to hurt to poo and pee. And there are certain ways you can take care of that. So we like to recommend doing a lot of sitz baths and taking, of course, your Tylenol and ibuprofen every 4 hours. And we also recommend using some ice packs. All of that is helpful to bring down the swelling and to help reduce the pain and to help you feel a little bit better. And if you have a C-section, then of course you've had a major abdominal surgery and you're basically cutting through 5 layers of fascia and muscle and tissue to get to the uterus. So give yourself lots of grace. If anybody here has had a C-section, or if you do have a C-section in the future, take good care of yourself because that's really important. So now the next step that I'll talk about a little bit more in detail is pelvic floor strengthening. Your body is, especially your pelvis, is going to go through immense amount of changes after you've had a baby. Nothing is going to feel right. Peeing is not going to feel okay. You might leak a little. You might dribble every now and then. It'll be hard to control. You might even have some gassy farts coming out of the coming out of your pee hole, which just doesn't make sense. You might feel a lot of pain when you're bending down, picking up stuff. All of that is normal, and pelvic floor strengthening will go a long way. So now let's talk about some of the emotional aspects, right? So because of hormone changes that we experience right after birth, it is normal to experience what we call baby blues. Baby blues is basically a very sudden dip in your mood. You're going to start to feel very sad, somnolent. There's like, for example, like I can talk about myself. I was pretty much crying straight for the first 2 weeks, because everything feels really overwhelming, right? Like you're still recovering, you're in a lot of pain, and you have to take care of a baby. The baby is going to like to stay up all night, so you're not going to get any sleep. So a lot of changes happening at the same time, along with the hormonal changes that are happening in your body. So that will contribute to some feelings of sadness, which will go away eventually. So it's very important to lean on your village, get all the support you need, lean on to your family and friends, and don't hesitate to ask for help. And the next thing I would like to talk about is actually postpartum depression. So, postpartum depression is a little bit different than baby blues. So, for a lot of people, it can it can prolong for a very very long amount of time. So, because of the hormonal changes that go through in our bodies, and if we don't necessarily get the support we need, or if we don't necessarily have the kind of postpartum experience that you should get, it is very very common to be able to have altered mental changes and get these feelings of persistent sadness and irritability. And if that is happening, and if you feel like that's hindering your ability to take care of your baby, and sometimes you can even feel a little bit of resentment towards your baby, that now I have this baby and I don't know how to take care of this baby's keeping me up at night, feeling really overwhelmed. If you ever experience any of those symptoms, then it's always really important to seek out professional help. Postpartum anxiety is also something that's not very talked about often, and I have just touched upon it a little bit right here. So, postpartum anxiety, it often overlaps with PPD. Again, very, very common, less talked about though, where you will often experience like excessive worrying, racing thoughts, insomnia, physical tension, and there's a lot of treatment out there available for all of this. So make sure that when you go see your OB, you do talk about what you're experiencing and you do try to seek the help that you need. Another really rare occurrence is postpartum psychosis, which is very dangerous. It's rare, but it can also happen. And I've personally seen patients experience postpartum psychosis. In that, you can have some very scary thoughts. You can even have thoughts about hurting yourself or even hurting your baby. And it's just important to raise more awareness about postpartum psychosis because it often goes undiagnosed for a very long period of time, and then it can become very resistant to treatment as well. All right, so now going back and let's talk about a little bit about nutrition and hydration. So it's very easy to self neglect, right? Like now you have a baby, you want to take care of your baby full time, you just think about your baby and you neglect yourself. But that's where we go wrong. You have to eat well and you have to try to recover your strength back again. And there's a lot of cultural foods that people push on us as well when we're going through this phase, but there's no specific food that you need to eat. You just need to have a well balanced diet, a high protein diet, eating iron rich foods, calcium and vitamin D. All of that is going to be helpful to make a full recovery, and emphasis on protein because I often see in our culture where people are postpartum and they're often just eating stuff like soji or the gold papris, and like they're just eating a lot of like sugar and carbs, and they're not necessarily consuming enough protein, which is what's going to help you make a full recovery faster, and it will also help you with your breast milk production. Sleep when the baby sleeps, everybody says that, but it's never like it's not possible to do that because when the baby sleeps you kind of want to take a break, you want to watch TV, you want to scroll social media. So I've put it in because that's the recommendation, but it's never going to be applicable. So sleep when you can, but I don't know about sleeping when the baby sleeps. Accept help from family and friends. That's extremely, extremely important. Accept help and ask for help. Do not try to be a do it all and be like, I will do everything myself. No, you cannot. You just physically cannot right now. Avoid overexertion and try to create a restful and a positive environment for yourself. In terms of physical activity, of course, it'll take a lot of time for you to feel like yourself again. I would say that now that I'm 4 months postpartum, I have started to feel more like myself again. But the initial couple months, I was really struggling, especially with my physical activity. Um, oftentimes it will hurt a lot to when you take your first couple of steps, but you just got to push through. So just start off with light walking. After 2 weeks of giving birth, do your pelvic floor physio. We are lucky to be in a country where we do have pelvic floor physiotherapy available quite widely, especially if you have insurance coverage. And listen to your body. Do a lot of like breathing exercises, core breathing exercises, because what happens is we lose that mind to core connection. So our brain is no longer able to listen to our abdominal muscles and our core muscles. So strengthening the core, doing gentle breathing exercises is very important after the first few days of being postpartum. And breastfeeding. This is, I would say, one of the most difficult things you are going to do as a postpartum mom. Breastfeeding is hard. It is extremely hard. It is extremely demanding, and it is mentally and physically demanding. But it's such a privilege to be able to give nourishment to your own child. And of course, breast milk is the best food for your baby. So some tips here that in the beginning the baby is going to be doing what we call cluster feeding. So in cluster feeding means that the baby is just going to be constantly latched to your nipple. It's going to hurt a lot. It's going to be sore because the milk is still coming in, and that's normal. So you just have to ride that phase out. So frequent nursing will help with your milk supply. It will help build that oxytocin release that will produce more milk. It is very important to make sure that you have a proper latch. So I'll give some tips on how to do a proper latch later on. A proper latch will help to prevent pain for you. And I often see that there's not too much awareness about latching and proper latches, which is really, really important. Um, and there are lots of things you can do to help your nipples feel better. There's nipple creams. There's also silverettes, which I completely swore by. They're like little silver discs that help prevent friction on your nipples. So it really helps in like healing, in wound healing, and it helps any friction against clothes and things like that, because initially your breast can be really, really sore. It gets better eventually, I promise. And of course, if you still cannot figure it out, if your baby has a bad latch or if you have any issues, you should always reach out to a lactation consultant, because truly they are amazing. They know what they're doing, and seeking out that help will make a big difference. So, steps for a proper latch. The important reason to have a good latch is so that the baby is able to extract milk better in a shorter duration of time, and you have less nipple pain. So the way you're supposed to have a proper latch is first that you want to be tummy to tummy. So the baby needs to be facing you, to your, like their tummy needs to be facing your tummy. It is ideal that in the first couple of days of life you try to do it without your clothes, so your top off, and the baby should just be in a diaper. And this way you are encouraging more skin to skin. That will help your baby bond with you better. It will help. It'll help with your milk letdown. It'll help with oxytocin release as well. So you want to support your breast with the C hold. You wait for the baby to open their mouth really, really wide. And then with your nipple at their nose level, you bring the baby to the breast. So I often see where people just shove the breast in the baby's mouth. That's not the right way. You have to bring the baby to your breast and let them latch. So that's how you get a proper latch. And when they've latched, they should take in most of the areola, so which is like the brown part of our nipple. Most of it should be in their mouth, not just the nipple. Their chin should be touching the breast, and their nose should not be buried into your nipple. So the nose should be away from your nipple, and the chin should be touching the breast. So good latch indicators is like a wide mouth with fishy, like like a fishy mouth, uh, which we also call flanged lips, but the easiest way to describe it is like a fish mouth, a tugging sensation, no pain, You can hear the swallowing, and baby is relaxed after feeding. So all of these are good signs that baby is well fed. Postpartum warning signs. It's important to know when to go to the hospital after you've come back from giving birth. So, of course, if you're bleeding very, very heavily, you're soaking a pad every hour, that's a very dangerous sign of postpartum hemorrhage. High fever, severe abdominal pain, thoughts about harming yourself or baby, any signs of infection. So, this we talked about already. Support systems, which I touched upon, very, very important to reach out for support. Um, and then, yeah, let's talk a little bit about how to take care of your newborn, right? So now suddenly you have this little baby. The baby's just like a potato because the baby's not like doing anything except crying and sleeping, right? And you want to learn how to best take care of your baby. So newborns are very susceptible to suffocation, and they are very susceptible to have their airway blocked easily by any kind of loose material that's around your bed or any kind of bedding that's loose. So it's very important to make sure that you follow safe sleep guidelines. So always put the baby on their back to sleep. Always use a firm surface without any pillows or soft bedding. You want to share a room, but ideally not a bed. So ideally, the baby needs to be in their own sleeping space, like a bassinet or a crib, or and even if the baby is sleeping next to you, if you're co-sleeping with your baby, you should always make sure that the baby is sleeping on a firm surface with no loose bedding around you. Avoid overheating. Dress the baby appropriately. So that's another thing. I often see people just putting lots and lots of layers on a newborn. If you are okay in a t-shirt, then that means you just need to put one more layer on your baby, not more than that. So just one more layer to what you are currently wearing. That is a recommendation. And breastfeeding also is very protective against SIDS. So it's always good to breastfeed, avoid smoke exposure during and after pregnancy, and avoid smoking ever around, like around the baby. And using a pacifier at nap and bedtime can also be protective against SIDS. But then at the same time, you want to be careful about breastfeeding. If you're breastfeeding, you don't want to cause nipple confusion that sometimes can happen with newborns. So you want to start giving a pacifier after breastfeeding is completely established. And baby's brain development. So people often have questions about how do I help my baby? Like how is my baby's developed? The first 3 months of life, the baby's brain is developing rapidly. And the key points are that they are absorbing everything like a sponge, like what's happening in their environment, the experiences, it's helping them, their learning, their problem solving skills, their emotional health. So it's very important to always have positive and loving interactions around them, even if like you're having an argument in the same room as the baby, even if you feel like the baby's sleeping or the baby is just there and you're thinking, oh, it's just a baby. What does the baby know? But no, the baby's nervous system is able to intercept all emotional reactions and is internalizing that. So you always want to make sure that you are providing a very positive, nurturing environment to your baby. So always respond sensitively to your baby's needs. I know there's a lot of like schools of thought where they're like, let the baby cry it out, etc. But now research is showing us that it's very important to reach out to your baby and to listen to their cues and to respond to them emotionally, like hold them close to you, because that's what they want. That's how the nervous system calms down. That is how they learn who their caregivers are and how they emotionally become more mature. So talk to them, sing to them, read to them, play simple games with them, make eye contact, do lots and lots of skin to skin. I highly recommend parents to do skin to skin with their baby. That first month of life, it's very, very important for them to be able to bond with you better. It's good for their sleep. It's good for their overall brain development, and help create a safe space for exploration as well. So this is something I feel like it's kind of neglected. Not many people have a lot of confusion about the good number of poos and pees. So let's start with poops. So the first poops are always going to be really dark and very black, almost green black in color, and that is normal. That's called meconium. Eventually, as the baby will feed, you will start noticing that the stool is going to become a lot yellower. It's going to be very watery and seedy, and poops can range from anywhere from 1 to 3 soiled diapers a day. A formula fed baby, then sometimes it can be a little bit brown and pasty. That is normal. The main thing is that you always want to make sure that there are no red flags. So you need to talk to your doctor if the poop is black after 3 days, or if there is any red color, or if the poop starts to look very beige or white or pasty. That is a sign of jaundice. Or the dark stool can be a sign of bleeding. So you want to make sure that you rule all of that out. Next, hiccups are actually very, very common in newborns after feedings. They do go away on their own. You can try to feed the baby more to calm the hiccups down. And hiccups are not a red flag, they're very normal. The baby's stomach is just really small, and eventually, as the baby's stomach will grow in size, the hiccups will eventually become less and less. Pee. Peeing is extremely important because you want to make sure that your baby is well hydrated. So I always say that the number of days of life is the number of wet diapers you need to have. So if the baby is 1 day old, you will have one wet diaper, 2 days old, two wet diapers, and so on. It's normal to have to see like a little bit of a pinker pee and like orangey pee. That's normal in the first 2 3 days of life. Sometimes you will also see some bleeding if you have a baby girl, and that is also considered to be normal in the beginning. And the key is that if the pee output is low, then that means that your baby is not hydrated enough and you need to feed your baby more. And again, I'm just talking about like a little bit of red flags around here. So how do you know like when to like what's going on with your baby? Is your baby okay? Or is something going wrong with your baby? Should I take the baby to the hospital? So some of the key factors is, for example, if your baby has frequent projectile vomiting, that means that there's something wrong with the stomach. So there's something wrong in the sphincter of your stomach that the baby is not able to take the feeds in properly and is vomiting it all out. So that is a condition called pyloric stenosis, and that needs to be worked up by your doctor. Or if the baby is very, very sleepy or very hard to wake up, that's always a bad sign. It means either the baby is very dehydrated, or the baby is going through sepsis or fever. So you always want to make sure that if your baby is extremely, extremely sleepy, it's normal for newborns to sleep up to 16 hours, but if they're not waking up at all, then that's a red flag. If the baby's skin is very pale or gray, and if you feel that the baby has a bit of a temperature, especially if the temperature is more than 38 degrees Celsius, then that is, you need to go to the ER. Breathing, if you feel that the baby is having like flared nostrils, you will see some like signs of breathing in like around the neck. You will see skin between the ribs being pulled in, or you will hear wheezing sounds, like very like whistling type of sounds. Then that means that baby's having difficulty breathing, and that also needs to be worked up. And then I also talked about peeing orange crystals or like reddish pee after day 3 of life. And when to call 911, right? So similar guidelines, but if the baby is ingested, if the baby is choking, has trouble breathing, it has become really pale or blue, had a swollen tongue, mouth, or throat, that could be a sign of an allergic reaction, which is life threatening, or if the baby is unresponsive. So yeah, that pretty much brings our presentation to an end. The whole point is that if you are somebody who is newly postpartum or who's planning on having a baby in the future, the point of this presentation was just to kind of create a little bit of awareness of what to expect when you do experience that. It's going to be the most dramatic change you're going to ever experience in your life. So give yourself a lot of grace, a lot of love, and eventually you will feel like yourself again. And in return, you're going to have this beautiful baby that you're going to love so, so much. So it somehow makes it all worth it. So, yeah. So, yeah, that's pretty much it on my end.
Thank you so much, Dr. Munira. That was really interesting. We do have a couple of questions, and I'll go into it. It's
Yeah.
interesting hearing your perspective, having, gone through it all recently. And I think a lot of it can be really scary, and I think that's a really big thing to highlight that it is scary being a new mom, and I think unfortunately we don't talk about it as much, right? Like we don't talk about everyone talks about how exciting it is to have a baby, but not so
Yeah.
much how difficult that initial postpartum period is, and the mom stress, the feeling of that overwhelming feeling of having to now look after a newborn. Also when you have multiple kids, right? Like dealing with all the children together, like it can be really difficult. So
Yeah.
it's definitely useful to highlight. There's a question asked on the chat. So how long are babies susceptible to SIDS, and when are they in the clear?
So, so guidelines say that up to 12 months, a baby can be susceptible to SIDS. Of course, the risk will decrease after 4 months. So 4 months is kind of like supposed to be the golden age where you feel like, because now the baby has learned how to roll, you think that, okay, if the baby's ever in an unsafe position, the baby will learn to take care of itself and just like roll back. But officially, it's up to 12 months. Yeah.
I mean, I think like the point of this is also not to get scared, because there
Yeah.
are red flags and stuff, but a lot of this you do have help and ask, like we're all happy for you to reach out if you have any questions. Your healthcare providers will be open. If you're not sure about something, just
Mhm.
ask, but don't use this to scare you. You don't need to be sitting there with a thermometer checking your baby's
Exactly.
temperature,
And you don't have to buy any of those fancy like
yeah,
outlet socks
exactly.
or those like heart rate monitors.
Yeah.
You don't need any of that. So just like a space with no loose bedding, make sure the baby's on their back. Yeah, I think that's pretty much it for safe sleep guidelines. And if you do want to co-sleep, like I personally do co-sleep, so no judgment to people who co-sleep. You need to follow something called the SS7, which is the safe co-sleeping guidelines. So these are just some pointers that you need to follow in order to be able to co-sleep safely with your baby.
Can you maybe go
Yeah.
through some of those?
Yeah, so I can just really quickly pull it up so I don't miss out or any. But there's one where basically it's like you want to make sure that there's no loose bedding around you. You want to make sure that nobody's smoking. There's no exposure to smoke because smoking can increase risk of SIDS. And then you want to be in a C curl. So when you are sleeping with your baby, you want to make sure that you are curled like on your side and you are curled around your baby, and that's very uncomfortable to be in that position, but you cannot, if you lay flat, it studies say that it increases the risk of SIDS. So it's recommended that you are staying in a C curl position. And again, it's important that your baby is healthy. So a baby needs to be full term, baby needs to be healthy, baby should not have any kind of like respiratory issues or any kind of like health issues, then it's not recommended to co-sleep. Baby needs to be on their back. Baby needs to be like ideally not swaddled, but you can swaddle the baby, but just you want to make sure that there's nothing else, like nothing loose around the baby. And no extra pillows, no toys, no heavy covers, not a super soft mattress, no strings or cords. And you want to make sure that if there's any like dips in your bed or any spaces in your bed, like suppose if there's like a gap between the mattress and the headboard or the mattress on the side of your bed, you want to make sure you fill all those gaps up. And yeah, no alcohol as well. So so that's pretty much it for the safe sleeping guidelines.
Thanks so much, Munirabin, for the brutal, honesty that comes with being postpartum. I remember I couldn't walk after my first for about a week. I couldn't turn in bed. I couldn't get in the bathtub because I was in labor for so long and had the
Yep.
stitches, and it was just you're not yourself. Like you lose that bit of independence, and it's quite scary. And then the emotions just out of nowhere, you're holding your brand new baby and you're crying, and you know, your husband's asking, "Why are you crying?
Why are
You
you
just had a
crying?
baby.
They're
You
like
just had a
clueless.
baby."
Yeah.
Yeah,
And it's
exactly.
like, I don't know. So
Yeah.
so thank you so much for all the, like, it's a beautiful thing, but it's what a woman's body goes through during and after pregnancy is just, it's wild.
Yeah,
And
we're
everyone's,
remarkable.
yeah,
Women
yeah,
are superheroes. Like honestly, after going through it myself, I'm just like, it's crazy that we put ourselves through this again and again to bring life
yes,
into the world.
Yeah.
Like
so
we
true,
knowingly, willingly put ourselves through it.
so true.
I
Um,
my
yeah,
I remember I don't know if Rashida remembers, but when I'd had my baby on my chatti, my mom went to Rashida and she was like, "Is this normal?" Like Fatima just randomly starts crying.
I
I don't know what
remember.
to do about it.
Yeah, yeah. They're like, yep, it's normal.
Yeah,
Yeah,
Okay.
I had a question, Maria Ben. If you can
yeah.
talk a little bit about febrile seizures. I know there's a common misconception when a baby has a fever to put layers on them and to just make sure you put layers and layers and layers. And that can be quite dangerous if a baby has a fever. So can you talk a little bit about like febrile seizures and why putting layers on a baby who has a fever is not a good idea?
Yeah. Yeah, so basically, babies, unlike adults, babies don't really have what we call like a strong vasomotor system, right? So they cannot regulate their body temperature. So they're dependent upon us to make sure that we keep them comfortable at a set temperature, which guideline says roughly anywhere around 18 to 21 degrees Celsius. So even like the room that the baby needs to be in, it should be a cool room. It can never be like a hot room. It should never be over 21 degrees Celsius. So what happens is that when the baby's having a fever, right, naturally their body temperature is extremely high. So then what causes febrile seizures is actually a high fever. So when the baby will start developing a very, very high grade fever, mostly like around, or I would say like around 40 degrees Celsius and above, that is when the baby is now at risk of developing a febrile seizure. So what you want to make sure is when the baby has a fever is you want to cool the baby down. But again, not cool down the baby a bit too much. So like you don't want to layer the baby. You can put some light, like a little bit of a cool cloth, like in the baby's axilla and the baby's like gentle area, just to kind of help cool their body temperature down a little bit. You're obviously using Tylenol as well to help bring the temperature down if they're over 3 months. So if you're already taking all these steps to help reduce the body temperature down, you are reducing the risk of developing febrile seizures. However, if you're putting layers on them while they're already having a fever because the baby's shivering or if the baby is looking actively sick, then obviously you're increasing the risk of developing a febrile seizure. Another thing is that if your baby's ever having a fever, and they're less than, I would say, 6 months, you are supposed to take them to the hospital. You cannot keep a baby with fever at home because they are extremely at risk of developing what we call sepsis or septic shock, which is life threatening for the baby. So, if you ever see a temperature more than 38 degrees Celsius and underarm temperature, which is what most people take, because most people don't take a rectal temperature, which is the most accurate temperature, if it's more than 37, you want to talk to your doctor about it and you want to get the baby evaluated as soon as possible. So that's
Perfect.
my,
Thank you
yeah.
so much.
There's another question in the chat, and please, if anyone wants to unmute and ask questions,
Yeah.
please feel free to do so. There's another question: when is it appropriate to start baby wearing?
Yeah.
And safety
So
tips around that.
So baby wearing is all the rage these days, right? It's all over social media, lots of wraps and carriers and blah blah blah. Everything's out there. So baby wearing is supposed to be really good for your baby. It helps to create a lot of bonding. It's good for your arms, right? Because like you're suddenly your hands free, so you can do stuff around the house. So all of that is great, but it's very important to wear the baby safely, okay? And you can wrap a newborn and you can wear a newborn as well, but it has to be done extremely safely. So for a newborn, I would say the best wraps are like the soft wraps. So you have like the Solly wrap and the Mobi. Those are like soft, like cloth-based wraps that you tie onto your body. And then you have ring slings. So ring sling is like a type of wrap where you kind of loop the baby over like in a cloth and you tie it up on a ring. Those are the safest for newborns. I would not recommend any kind of structured carriers, like a structured baby carrier, until at least the baby is 3 months, because the baby is just simply not tall enough to be able to fit into a carrier and have their face like unexposed. They're so small that it's very easy for them to suffocate like on your body in a structured carrier. And the next thing is that when you are bearing your baby, you're supposed to make sure that their body is in an ergonomic shape. So you want to make sure that the hips are lower than their knees, and it's called the M position. So this is the hips, and these are the knees, and it should be like an M shape when you are wearing them on your body. So you want to make sure that you have the position correct. You want to make sure that their face is facing outwards, is not stuffed into your chest, and is not being their nose and their face is not being blocked by anything. So these are just some recommendations that you need to follow if you are baby wearing. There are lots of tutorials out there, lots of YouTube videos. So do it, but do it safely and follow the recommendations when you are doing it. Yeah.
Thank you. And another question. From what I understand, and my apologies if it's a basic question, I'm soon to be a full-time mom. The baby needs to be put in a crib without swaddles or anything else. Just put them in a crib or in a onesie. Is that right?
Okay, so I feel like I should have talked about this in my presentation. I'm sorry I did not. Swaddling. Okay, there is a lot of misconception about swaddling. So the main reason why we swaddle the baby is because the babies have an inbuilt reflex known as the Moro reflex, or also known as the startle reflex. That basically they can just they any kind of stimulus will just startle them and they will wake up, right? Like they will just startle themselves awake. So the whole point of swaddling is that you want to help them feel really cocooned and like warm and cozy, because when they're like in our uterus, they're basically very warm and they're like all scrunched up like in a small little ball like inside our bodies, right? So you want to emulate that feeling of coziness. So that is why we swaddle the baby. And you want to help reduce the impact of the startle reflex so the baby can stay asleep for longer and can sleep calmly. So that is the whole point of swaddling. You can put the baby in a swaddle in a crib, but I would highly recommend to use a swaddle that either has a zip or is velcroed. You should not be using a swaddle that's just kapru, which is what most people use, because it's very easy for the cloth to untie itself. So I would I know like old school, like my mom, for example, my mom was like, what is this Velcro and this zipper nonsense? Like, like हमें तो मतलब कपड़ू बांध दिए हैं, like that, because that's what they've grown up with. But it's very easy for those to like open up, especially if you have a very active baby, because a lot of newborns, they go through what we call active sleep. So they move around in their sleep a lot. They're going to kick their arms and legs a lot. So it's very easy for the swaddle to like open itself up and for it to fall on their face. So I would recommend like a Velcro or like a zipper based swaddle so that they're nicely tucked in. And then you can just put them in their crib with nothing else, with no other like, loose bedding or blankets or anything on them. And I would highly recommend, please do not use any kind of fleece, like onesies or fleece blankets around them, because fleece is made out of polyester. So it's extremely unbreathable. Like you basically, if you put fleece on yourself, you're not going to be able to breathe. So you want to make sure that whatever you're using is very breathable. The kind of sheets you're using, the kind of onesies you're using should be just sort of pure organic cotton, so that it's all breathable material and it lets their skin breathe, because their skin is extremely tender. So yeah, that's and also you need to stop swaddling after 3 months, because that's when the baby will start to roll. So ideally you should just put, if you are swaddling them, you want to make sure their hands are free, because if their hands are also closed in and if they roll, they cannot put themselves back like on their back again. So you want to make sure you stop swaddling around that age. Yeah.
Yeah. So the idea is just basically that there's nothing loose on them, right? So if you swaddle them,
Yeah.
it shouldn't be even up to their neck where their head can go in and they can
Yeah.
basically suffocate themselves, right?
And another misconception, like if you have what we call like a reflux baby or like a colicky baby, like my baby had a little bit of reflux, right? So it's very common when you have a refluxy baby to want to put the baby on a bit of an incline when they're sleeping. I've seen like a lot of people do that. And people in hospitals, we actually do put babies at an incline to help with the reflux, but that's not something you can do at home. And the main reason why is that the inclined position needs to be kept at 15 degrees, not more, not less. If you're going to do more than 15 degrees, what basically can happen is their chin will collapse on their chest, and that can close up their airway. And this is something that actually personally happened with me. Like a lot of members in my family, they were like, oh, like you should put it, like you should prop the head up a little bit so that the milk stays down. And we tried that for a little bit, and I personally saw once my baby, like her chin just completely collapsed on her chest and she woke up choking. So just never ever do that. Just learn from my mistakes. Please don't do that. Yeah, it's very unsafe. The baby always needs to be flat on their back. Yeah, sorry, I have a lot of opinions about a lot of things after having
So,
experienced all of this.
yeah, that's why it helps you being so fresh with going
Yeah,
through it actually now, right? So,
yeah, exactly. It's all very, very fresh.
yeah. Yeah, I think postpartum was a it's a time that's very difficult to prepare for in advance, right? Because there isn't
Yeah,
really like you're kind of excited about the baby coming and you're kind
yeah,
of I think the moms tend to forget what they went through. And so you kind of feel like you're struggling on your own a lot of the time. And
yeah,
it's not true. We
definitely.
all we all have we all had it we all have it hard. It's
Yeah,
just how we make it through that time is very different. And it helps talking about it, right? So that you don't feel
yeah,
like you're on your own.
yeah, exactly. And oh my God, thank you for asking this question. I know it's very common practice to bring your babies in a car seat in the masjid, right? The baby should not be in a car seat for more than 2 hours. The position that the baby is in the car seat is not good for their airway, it's not good for their body, especially not good for their spine and their hip development. So it is not recommended to keep a baby in the car seat for more than 2 hours. The recommendation is actually 30 minutes, but 2 hours is the max you can stretch it to keep a small baby in the car seat. So from 0 to 3 months, we should be very mindful about that. Yeah.
What's your opinion on the car seat covers?
Car seat covers, it's very important for them to be breathable. So if they have like a mesh area around them, it's very important for to have that mesh area. I get it, like it's cold, you're taking your baby out in the cold, then you want to have a cover on, but you should always make sure that there's a little bit of a segment where there's air passing through so that the baby doesn't suffocate. And also, like for summertime, I would just recommend no covers. Like if you are using a cover, you want to make sure you're using a fan, like a stroller fan, or like in your car seat as well, so that the baby does not overheat. Like I especially see a lot of people, like right now it's so hot, right? You take the baby out and you're putting a muslin, like a cloth over the baby. Yeah, the muslin is breathable, but it's still going to increase the temperature inside the car seat, right? Because it's still going to prevent airflow from coming into the car seat, and that's going to rise the temperature even more, so it's going to make your baby even hotter. So that's something that you should be really mindful about, especially in the summertime, I feel. Yeah, sun exposure is very important. You are supposed to be using a UV blocking hat on your baby if your baby is outside because they cannot wear sunscreen. You are supposed to put clothing on that even if it's like not full sleeves, you should at least try and make sure that they are being covered by UV blocking, either like a UV blocking cover, or if your car seat needs to have a canopy that can block UV light. So you want to make sure that you take these steps. And we are living in a country where like the UV light is really strong. So a hat, I feel like a hat is a good way to go, like with a very wide brim all around, that can help reduce some of the exposure. And you want to make sure that you take your baby indoors and you try to reduce the amount of time that they're outside in the sun. So frequent indoor breaks. Yeah. Thank you for the question, Zara. It's a very important question. I actually had to look it up. I didn't know. But because it's so hot these days, and I'm not using a sunscreen on my baby. So I was like, what am I supposed to do? So I just bought like these really cute wide brim hats, and I've been using those on her when we do go outside. Yeah. So I like how there are so many questions about like just like how to take care of a newborn, because there's really no like blueprint or like guidance out there. Like basically, it's a postpartum. All we have is like that 1 6 week postpartum visit, and that's it. And then you're just going for the baby's vaccines at 2 and 4 months, right? So what about all that gap and time in between? Like, who are you supposed to go to and like ask all these questions and get all the information from? It's very tricky.
What's been your toughest challenge in your postpartum period?
Um,
Mind sharing?
I would say like the first 3 months were really hard because my baby had a lot of reflux. So she was often very unhappy after feeds. So it was very challenging where like, oh, I'm supposed to like be breastfeeding her, and this is supposed to bring my baby nourishment, and it's supposed to, it's like her only form of sustenance. And at the same time, this is what's causing her distress. Right. So like that whole experience is very troublesome because like you're scared of feeding your baby, but at the same time you have to feed your baby. And I had to do a lot of like lactation consults and stuff like that to really figure out what was going on. Is like, was it a latch problem, or like is it just like a developmental thing that my baby will soon outgrow? And now finally I would say after 3 months, her tummy's gotten a little bit bigger, so things have gotten a little bit better. But I would say if you have a newborn that's colicky or has reflux, it's really, really difficult. And I'm in solidarity with you. So if any of you experience that, you can always come up to me and like vent and like rant about it, and I will understand because I have lived through it. Yeah.
Um,
Yeah.
Too, by the way.
Yeah.
There's a couple of questions on there. How
Yeah.
long is it normal for postpartum bleeding to occur? And the second one is what happens if we can't get some vaccines on the 2 to 4 month time markers exactly? For
Mhm.
example, due to travel, is it okay to get it at, for example, 5 months instead of 4?
Right. So postpartum bleeding can actually happen for a very long time. It can happen to even up to 3 months in some cases. So when I say it can happen up to 3 months, it means it doesn't mean that you're going to be bleeding like buckets and buckets every day. No, like that initial bleeding, that first 2 weeks is going to be a little bit of a heavier bleed, where you're going to be using like diaper, like literally wearing a diaper, like and you're going to be discarding that every couple of hours. But eventually it will just be like a slow, like a slight amount of spotting that can stay on for, I would say, even up to 3 months in some cases. It's a myth that it's only until 6 weeks. It can go on for longer. Like for me, in my case, like I bled consistently up until 10 weeks postpartum. It was just like a light amount of spotting towards the end, but like I wasn't completely clear up until 10 weeks, so that can happen. And that is normal. So okay, yeah, just get ready and stock up like on a lot of pads. You're gonna give them a lot of business for like quite a bit of time. Yeah, get those Knix underwear, that's leak proof. Um, Oh yeah, good question. There's a lot of products out there that are being marketed for good postpartum products, but some of my recommendations are that, so for example, like the big pads, you're going to get some pads from the hospital, like the big ones. They're not easily available in the market otherwise. So make sure that you just take some from the hospital. Just ask the nurse nicely, can I please have some more, and just take some more. They even have disposable underwear, so I would highly recommend just like grab some of that as well. They will also give you like the sits bath seat, so you can just put that on your toilet. So they also have that at the hospital. So just ask for it; they'll give it to you. And that is very important to do some sitz bath. So what a sitz bath is basically you just like put a little bit of salt, Epsom salt, and hot water, and then you you sit in the toilet with that seat on, and it will just help to kind of reduce the inflammation and reduce the swelling and the pain down there. So it's important to get some of those things and just try to get them for free because you're going to get them at the hospital. So I wouldn't spend any money on that. Next thing is ice packs. So hospitals also provide you ice packs, but they're not going to give you enough. That first week, I was really using those ice packs quite a bit because it just felt really good down there, like to feel a little bit of cooling. So I got the Freedom Mom ice packs. There are lots of other companies that make it too, so you can get those as well. And then Freedom Mom also makes like a cooling liner. It's like a witch hazel, like soaked with witch hazel cooling liner that you can put on your pad, and it just feels really nice. It's like anti-inflammatory with witch hazel, and it feels really good down there. So you can get that as well. I personally really enjoyed. I would say the cooling liner, I would say, was my main go-to item that I just really loved. So those are some of my recommendations. You can also try a belly binder. So a lot of people use a belly binder to kind of help, just push things in a little bit that first couple of weeks. It helps to kind of, just retract things a little bit faster. You can try that as well if you have the patience to put a belly binder on yourself. I did not. I tried it for like a few days, and then I was like, okay, I don't have time for this, so I stopped. But I was doing some core and breathing exercises, which I do feel like it does make a difference. Like when you consistently do them, it helps, like, gain a little bit of that core connection back. So lots of YouTube videos on how to do like postpartum breathing core exercises. Just like, honestly, just when your baby's sleeping and you're sitting next to your baby, just do some of them, like, gently, just like do some deep breathing and just pull your tummy in and do it gently. Yeah. So it makes a difference over time. And the question on vaccines. So the reason why we have the whole 2, 4, 6 month split on the vaccines is because there are multiple doses that you need to take of the same vaccine. So for people who don't know, at 2, 4, and 6 months, you're going to be getting the exact same. Like I think 2 and 4 months, you're getting the exact same vaccines. They're just multiple doses because that's how you build your immunity, right? So you get the first exposure, then you get the second exposure, and that is how the baby is going to develop immunity towards those specific vaccines. So you cannot, for example, you cannot do the 2 and 4 month vaccines all at once because it is the exact same vaccine. So if you are traveling or you miss the it because of travel, you miss the 2 month slot, you are going to be pushed back. So the vaccine that you were supposed to take at the 2 month mark, now you're going to be taking them at the 4 month mark, and the cycle is just going to be a little bit more delayed. Um, so that's like a personal decision that you can make for your baby if you want to kind of delay her vaccine or if you want to give it at the right time. So that's up to you. Or even if you're traveling, like, whatever country you're traveling to, you can also get the vaccines there, so that's also an option.
Can I just actually pitch into that as well?
Yeah.
I do have a lot of patients who do travel in between vaccines.
Yeah.
And so they don't have to always delay the entire cycle. So they can, if there's a
Yeah.
little bit of a delay, it's actually not a problem. But yes, as you said, they can have it in wherever they're. So if they're going, back home, like a lot of my patients are from India, for
Yeah.
example, so they can get, so you get a yellow card with all the whole vaccine schedule. So if you decide to take the 2 month one here, and then you're not back until the fifth month,
Yeah.
you can get your 4 months there, or you can get your fifth month, the 4 months here when you come back. It's just the 6 month that will be delayed. So you won't have it at 6 months, but you don't have to miss the whole cycle altogether
Yeah.
and delay all of it.
Yeah.
Okay. Yeah, just because I know a lot of my patients do travel in that time, and so it is okay to do.
Good question. Another question about like measles. I'm sure you're probably getting a lot of like measles cases because like it's like all the rage these days in Canada. Okay, I've grown up with measles, so like yeah, it's totally chill on my end, but I see so much hype about measles right now. So the reason why you don't give the MMR vaccine early is because it's a live vaccine, right? So that's why it's supposed to be given at the time it's given at, because we do not want to give a live vaccine to a very small baby. I don't know, like I don't know, Fatima, if you've ever administered the MMR vaccine a little bit earlier.
Yeah.
So I've given it at 6 months. For
Yeah.
I think public health recommend that you can give it at 6 months is the
Yeah.
earliest, but you still have to get it at 12 months and then at 4 years too.
Mhm.
So a patient may end up having 3 doses if
An
they do
additional
want to get
dose.
it early if they're in an area
Mhm.
where measles is prevalent.
Yeah.
So you can do that.
Yeah. That's right. That's what I face too. It just means it's not replacing the 1 year vaccine, it's just
Yeah,
adding on to it.
additional dose. Yeah. I hope that answers your question. I feel like we should do one on vaccines, because
Yeah. So,
even like I don't like, there's like so much, like my own husband has so much doubt against vaccines. He's like, vaccines is like a big propaganda, like
oh
I
goodness.
don't believe in it. It's just the pharma companies,
So
trying to bootleg us all these things. Like, where's the evidence that any of this stuff works? Most of these diseases are not even existing anymore. So yeah, I feel like one on vaccines is
we will actually, our next series is gonna be on like preventing
prevention.
illness, and vaccines will be one of them, inshallah.
Yeah, and we should definitely talk about the
Watch
COVID
this space.
vaccine and what it does, so people understand why taking that vaccine is important. Yeah.
Yes. I hope you changed your husband's mind.
I'm trying. I'm trying. It's a work in progress. Yeah. I sent him a study. It's like all these studies are funded by the pharma company, so I don't
Oh,
believe in
man.
any of them.
Yeah, it's not unusual. We do face
Yeah.
that. Not as many people actually. Most
Not
people
in this part of the world so
but
much.
yeah, but I do get a few who don't want to, and then
Mm.
suddenly, because they realize that you can't get into public school without vaccines, I usually get people then who suddenly need to get all of the childhood vaccines, so we have to do an accelerated schedule.
Yeah.
But yeah,
I have a family of adults who, for some reason, didn't get vaccinated as children and now are getting their vaccines,
oh wow.
Mhm.
all of them. So they're all in their 20s and they're all getting vaccinated just because
Mhm.
now they've decided they want to make the decision for themselves and they're giving them. So,
They had
yeah,
anti-vaxxer parents.
yeah, yeah.
Yeah, and I think even just adult vaccines too, right? Like about the vaccines we need to have in pregnancy, like the
Yeah.
whooping
Hmm.
and tetanus and stuff.
Yeah, the rubella and the tetanus. Yeah. Yeah.
Yeah.
Okay, awesome. Well, thank you very, very much
Yeah.
for
Thank
the
you so much for having me. Yeah, absolutely. Thank you for all the questions. And yeah, I was so scared nobody's going to show up, but I'm so glad so many people did. And like, we had a pretty meaningful discussion. So that's awesome.
yeah.
Yeah.
Thank you everyone for attending too.
Yeah. Yeah. Thank you so much. Have a good night.